Welcome everyone to today's webinar. My name is Helen Brown and I am today's moderator. Firstly, it's my great pleasure to hand over to Eduardo Banzon, ADB's Director of the Health Practice Team, the Human and Social Development Sectors Office, for his opening remarks on transforming health systems for climate resilience. Thanks, Dr. Dodo.
Thank you, Helen, and thank you to everyone who are joining us this afternoon. I think by now we know the challenge of climate change. I think every day, particularly here in Asia, in Southeast Asia, Pacific, as we walk outside, we've seen how hot Asia has become. But of course, more than that, the numbers that we're seeing, in which we have seen average global temperature, the extent of carbon emissions that's happening, basically shows that the challenge of climate change is happening, and that and then the repercussions, the effect of climate change is something that the world, has to adapt to, and the health systems have to adapt to. And what are these impact or changes that we're seeing? Is going to see heat. We've already been talking about that. We're talking about here in countries where that's been regular, how do we call it, where typhoons or hurricanes or cyclones or whatever you call it are regular occurrences. We're seeing much more regular now. And of course, this is a world where this is an area where science is much behind on what we're really seeing as impact. And there'll be more, and we're sure, and I think everybody agrees there'll be more. So the challenge for us is how to make countries and people adapt to this climate change and health systems. Of course, in parallel, we also should push countries and, of course, health systems in particular, as well, I call it a moral imperative, to reduce their carbon emissions. But we also know that this reduction of carbon emissions takes time. And that by the time we know it, we're gonna take us decades as these emissions goes down, and probably as we can reverse some of the impact of climate change that we're seeing. So therefore, it's crucial at this point that we put in adaptation measures in our health systems, that we make sure that our health systems is resilient whenever there's going to be the next typhoon that hits Manila or the next cyclone that's gonna hit South Asia. We have to make sure that our health systems, our healthcare providers, our health facilities are well-versed in managing the impact of climate change. And today's webinar will be talking about that. I always sometimes argue the strengthening health system by itself is already adaptation. But I think we have to be more ambitious than just strengthening health system. We need to also make sure that our health systems are retrofitted, that it actually be well positioned to adapt to the adverse impact of climate change. In ADB, we call this type of project Type 2B, and we'll discuss much more thoroughly later. And we look forward to everyone to listening on how we should design Type 2B climate projects. And that, in a sense, this is something, and in this case, our friends from Lao PDR have actually done this already, how we could actually get our other developing members countries to it as well. So again, I welcome everyone to this very exciting, I call this exciting, very productive and very forward-looking first webinar that ADB will be having, health webinar ADB is having in the year of the fire horse. Okay, we know the year of the fire is a year of action. It's not a year of heat. It's a year of getting things done. So welcome everyone.
Fantastic. Thanks very much, Dr. Dodo. First of all, obviously, Dr. Dodo has just highlighted the immense challenges of climate change and the need for adaptation. And all of our speakers are going to be looking at how we can address that. Just before we start with the speakers, if you have any questions, please enter them into the chat function and we will come back to them in the last session of the webinar. I'd now like to introduce our first speaker, Martin Okata, who is responsible for providing strategic and technical expertise to support climate and disaster risk management across activities of the ADB's Climate Change, Resilience and Environment Cluster. Martin's presentation today will really set the scene in terms of the key principles that underpin ADB's climate risk management framework. So over to you. Thank you, Martin.
Thank you, Helen, for the kind introduction. Hello, everyone. Good afternoon, good morning. Let me start. Owing to the remarks of Director Eduardo, I believe I don't need to remind you of the needs for adaptation and resilience. Thus, I simply would like to remind you that implementing adaptation solutions has real benefits, such as avoiding losses, stimulating economic activity, and of course, delivering social and environmental co-benefits. However, in 2023, international public adaptation finance reached only about 26 billion, which is roughly more than 10 times less than what's needed annually for adaptation until 2035. And without investments in adaptation, this gap will just continue to widen. A few concepts needed in this topic are first, adaptation. In the health sector, adaptation means adjusting health systems to actual or expected climate impacts in order to protect lives and well-being. This can be incremental, for example, strengthening facilities or protocols to cope with higher temperatures, or transformational, which is the case of Type 2B projects, where it is required fundamentally changing how health services are planned or delivered. Another concept is resilience. Health system resilience is the capacity to absorb these climate shocks, continue delivering essential services, and reorganize when needed, but also learning and improving over time. And finally, systems. We always say that Type 2B projects are of the target system. A health system is not just hospitals or clinics, it includes other types of infrastructures, supply chains, workforce, information systems, and of course, communities. In this context, adaptation measures help build resilience, but resilience ultimately depends on how the entire health system functions under climate stress. To reduce vulnerability to climate change over the medium and long term, adaptation and resilience must be explicit objectives, not just incidental benefits. And this is why adaptation activities are best understood by this continuum. And by the way, you can find all of this content if you reached out to ADB staff and ask for the 2023 guidance note on developing projects that support adaptation and resilience outcomes. At one end, we have the Type 1 projects where development investments are climate-proofed, where designs are just simply adjusted so that assets can withstand climate impacts. And on the other hand, we have the Type 2B projects, which are driven primarily by adaptation. Here, reducing climate risk and overcoming barriers to adaptation is the core purpose. For this definitions, the key is that project intent drives classification. So many projects combine elements across types, but what matters is whether the project is designed to simply protect assets or to place the entire system on a resilient pathway. So this slide is showing how the same health sector investment can fall into different adaptation types, depending entirely on the intent and design. If the goal is to protect facilities, then the project is Type 1. But if adaptation safeguards the assets, but the wider health system remains unchanged. If the project is primarily motivated by rising climate-related health risks, then it becomes a Type 2B. In Type 2B projects, adaptation drives the project with outputs focused on early warning systems, disease prevention, and institutional reform. Assets, infrastructure, and investment may be included only where they directly support adaptation. Here, what it's important is that, as you can see, what changes is not the investment itself, but the intent, the scope, and system level ambition. This distinction is critical for identifying type 2B projects, what transformational is. This diagram is showing the 5 principles of developing projects that support climate adaptation and resilience outcomes. They're meant to guide good practice. However, how deeply they are applied will vary by country, sector, location, and even financing modality. They apply both for type 2A and type 2B projects. However, the way they are operationalized can differ. In type 2B projects, they more directly shape the project's core objectives, designs, and outputs as well. So principle 1, to apply this principle, we start by referring to the country's NDCs and NAPs. Regional or transboundary health issues, for example, the spread of vector-borne diseases across borders, can also be considered where relevant. And equally important to engage vulnerable communities, particularly women, to understand local risks and barriers to adaptation. And lessons from post-disaster needs assessments, past TAs, and ongoing projects in the pipeline can help identify opportunities for type 2B projects that can be both effective and eligible for co-financing. Principle 2 emphasizes on the fact that type 2B projects need to be based on climate risk and adaptation assessment of the target system, or CRAs, as we call them. A robust CRA combines bottom-up approaches, identifying vulnerabilities of specific facilities, but also top-down analysis of climate hazards, such as floods, heat waves, or disease vector expansion, for example. CRAs should consider near, medium, and long-term climate risks so that interventions remain effective as conditions change. And the findings of the CRA inform the project's objectives, outputs, the monitoring framework, but it also increases transparency for local stakeholders and governments about the residual risks, which is very important. Also, a well-conducted CRA aligns projects with global best practices, but also improves eligibility for climate finance, which you will see is one of the objectives of having these 5 principles. Principle 3 means going beyond incremental changes to more transformative actions in the case of type 2B projects, such as shifting health service delivery to climate resilient facilities, or introducing new surveillance and early warning systems for climate-sensitive diseases. Projects should identify barriers to transformation, which can be institutional, financial, technological, and include outputs that address these challenges. It is critical to consider trade-offs, avoid maladaptation, define acceptable residual risk, and also integrate learning and adaptive management so that interventions can remain effective as risks evolve in the future. Principle number 4, in type 2B projects, all project outputs should be explicitly seeking to reduce the impact of climate change on the target system. Adaptation and resilience are the focus of the outcome statement, and therefore all outcome level indicators should be resilience-based. Indicators help demonstrate results to governments and partners, but also increase the likelihood of securing co-financing from global climate funds, like the Green Climate Fund, for example. Principle number 5, for type 2B projects, all outputs should directly address climate risks, so 100% of the project cost can be counted as adaptation finance. To verify this, we follow the 3-step joint MDB methodology, which we need to make sure is in the project documents. First, we clearly state the climate vulnerability context, such as health facilities at risk of flooding or populations exposed to heat waves and vector-borne diseases. And second step, we provide a statement of intent confirming that building climate resilience is the primary goal of the project. So how do we reduce these identified vulnerabilities? finally linking the project activities to these identified risks. For example, by retrofitting health clinics or strengthening emergency response. Again, documenting this process in project reports and monitoring frameworks of the project documents not only ensures transparency, but also increases the credibility of the project and opens the doors for co-financing from global adaptation-oriented funds. I would like to close my intervention by showing this diagram that shows the life cycle of a project, particularly for type 2B projects, how all of these principles are embedded in the different activities across the different stages of the project cycle. We start by the scoping during the identification phase, where we start to identifying opportunities for adaptation. During project preparation phase, we conduct a very robust climate risk and adaptation assessment of the target system. And in the other documents, we will be including the outputs and the indicators to demonstrate how we are ensuring resilience through the implemented project. Thank you very much. Back to you. Thanks.
Thanks very much, Martin, for that really clear explanation of the principles that can be followed to help direct the design of climate adaptation projects. Our next speaker, Jasper Tromp from National University of Singapore, has a wealth of experience in projects that promote climate resilient health systems in Southeast Asia and the Pacific. Jasper's presentation leads on very nicely from Martin's by providing more detail about the methodologies used in climate risk and vulnerability assessments and how these can also help inform project design. So over to you. Thank you, Jasper.
Thank you very much, Helen, and thank you, everybody. It's a pleasure to be here. I'm going to share my slides. So thank you very much, and I'm very excited to talk to you today about the climate risk and vulnerability assessment, going from methodologies for evidence-based health system adaptation to program design and implementation. Now, what is a CRVA, or Climate Risk and Vulnerability Assessment? The Climate Risk and Vulnerability Assessment essentially transforms climate change impacts to health consequences, which then inform project design and finally also climate change finance eligibility, as Martin just pointed out. All projects within the bank or within the health sector at some level require a CRVA to look at the evidence base to identify the climate risks, and then using a systematic approach to then identify, prioritize, and address these climate vulnerabilities within the project. So essentially, the goal here is to move beyond that sort of anecdotal evidence to actually have informed, quantified, and projectable risk, both directly for the project, as well as to inform future project design to estimate activities that can help mitigate some of those risks. Now, the CRVA consists of 3 interconnected components, and this is also what we've done. So I was involved in the CRVA for the project in Laos that will be presented later on. But essentially, it consists of estimating the climate risk for the project. And the risk consists of 3 components, namely the climate hazard, the exposure, and the vulnerability or the adaptive capacity within the system that we're working. So the risk of climate to the project is twofold. One, there's a direct risk. So for example, if we're building a hospital, there might be a direct climate risk like a typhoon or a flood that can damage the hospital in the future, especially as climate heats up or there's more anticipated rain in the next 50 years. So to try to predict this and anticipate some of those changes to then adapt the design of, for example, the infrastructure to deal with it is one of the aims. But then at the same time, there are also indirect climate risks, and this is specifically true in health, because as many of you might know, climate change directly impacts the patient that we see in our clinics today. An increasing temperature will increase the risk of, for example, diseases like dengue, and increase the risk of heat stress, especially in elderly populations, which would mean that the people that we train today to see our patients tomorrow need to be prepared for addressing these additional burden and patients that will come into your clinics. Now, back to this slide, when we look at the hazard assessment, we essentially look at what climate threats currently affect the health system, and when, where, and with what intensity do these happen. So this means to look at, in the past, what were some of the climate risks that we'd observed? Were there floods? What was the temperature increase? What was the precipitation? But also we try to predict how will this go on into the future. So for the next 50 years, do we see an increase in temperature or decrease? Do we expect a change in patterns of rainfall or intensity of rain? Then we also look at the exposure. Which health facilities are exposed to these risks or these hazards? Which populations, and how are services affected? Do we anticipate in the future that there will be more rain, hence floods, which would prevent people from visiting a health facility because the road that they used to take to visit that health facility might be inaccessible? And then what is the magnitude and distribution of this exposure now, but also going forward? So again, there's that forward-looking prediction that we do here. Finally, we look at the vulnerability. So how sensitive are the exposed elements, and this could be either people or objects, so the infrastructure elements, to these climate hazards, and what is the existing capacity within that system to adapt to these climate hazards and the exposure? So are people well trained to treat climate change related diseases? Are there policies in place and plans in place for hospitals to operate during an emergency? All of these are key components that we do as part of that vulnerability and adaptive capacity assessment. Now, when diving a bit deeper into the hazard assessment, there are a number of tools and data sources, and I've tried to explicitly call out some of these tools during this presentation because it's something that you can actually take home and try out, because all of these tools are publicly available. There are a number of tools that can help with identifying either current or future hazards. Now, one of the more advanced tools to use would be to use existing climate models. An example of that is the CMIP6 model, which is freely available, but does require specific expertise to access the data, to analyze it, and to download that data and to interpret it. But that can give you, for different kind of scenarios, projections, and socioeconomic scenarios in the future, what would happen based on the emissions to the temperature that we expect in the future, temperature increases or decreases, precipitation patterns, and potentially even what the downstream effects would be on extreme events like floods or landslides. An easier tool to use would be to use open climate portals. So the World Bank, together with ADB MSA, has an open source climate portal. The address is here, where they've translated the information that some of these models provide into ready-to-interpret graphs per country that would estimate some of these climate risks today, but also in the next, something went wrong, in the next 100 years into the future. Finally, there are specific tools that have been designed explicitly to assess qualitatively hazards that might affect countries. One of this is the Think Hazard tool funded by the World Bank. And I gave an example here on the right, which is a publicly available tool that quantifies or in a qualitative way estimates the risks like river flood, urban flood, or coastal flood, etc., for either countries as a whole, and this is an example of Thailand, but also for sub-regional sections of the countries like municipalities or sub-regions. Finally, you can supplement this type of data with national climate data that might be available to you within your ministry or through other sources that can supplement any of the gaps in the estimations that are made in these publicly available models. Now, when we do the exposure assessment, we have to map the infrastructure and the services that are affected. So here we use GIS to map out facilities and the type of facilities that are affected by the climate hazards that we identified in the previous step. Here we look at the population served by the different health facilities, the catchment areas, but also at things like critical support systems like power and water and access to the health facility, which might be disrupted during a climate event. Tools that we can use for this would be open source GIS platforms like QGIS, ArcGIS, or OpenStreetMaps. You can also do this using public tools like R, and you can use readily available facility registries or publicly available health facility data, including Google Earth Engine and Copernicus, to identify the local potential hazards to the health facility. And to give you an example, you could use, for example, Google Earth Engine to see whether health facilities are positioned next to a potential hazardous location. And this could be a river, which is more prone to floods, the sea, or next to mountains, which poses an increased risk for landslides. And the last step, we look at the vulnerability and adaptive capacity assessment. And in the health sector, this goes beyond just looking at the infrastructure, but also looking at the content of the health facility. So we look at the structural elements, so the building design, the age of the building, the location, and the characteristics. How do they operate? Do they have backup power in case of a flood or an emergency? But then also at the people, what is the disease burden that we see now, today? And how is this going to develop in the future? And is the health system built to deal with this increased burden? One important framework to use would be the WHO framework for climate resilient health systems. And I've posted the central graph here on the right, which uses a structured way to assess different components of the health system to assess whether they are climate resilient ready for the future. And this includes, for example, assessing the leadership and governance of the health system. Does the leadership have the right policies in place to deal with the future demands from climate change? Is the health workforce prepared? Does the health information system have enough capability to deal with, for example, tracking a future increase in dengue cases, and so on? Now, assessment methods here is a bit more less organized, I guess, than in the previous, because there's less publicly available tools available. You can use a review of the existing literature. You would have to do a facility survey with inspections, key informant interviews with the folks within the Ministry of Health, but also a policy and document review, together with the historical event analysis to see where in the past there was a climate-related event and how the system responded to that. Now, when we do these assessments across these three areas, finally, it's the matter of going from these assessments to actual recommendations that will inform design of the project. And this requires risk scoring, which combines the hazard, exposure, and vulnerability for each facility or for different activities, and can then be translated to relatively simple ratings, whether they are at low, medium, or high risk. And then based on that, you can then prioritize balancing both the risk level, the population impacted by climate change, the importance of the service, but then also the feasibility of the potential adaptation measures that you would like to take. All of this would then translate into adaptation measures that would address some of the most important climate risks that you've identified in the CRVA. And this would translate into, well, finally, at the Type 2B project level, a priority investment plan, including the quantified finance needs, and then a monitoring framework that connects to the activities that you've identified based on those high-risk, critical sort of gaps in the health system that need to be addressed to improve resilience to climate change. Now, a real-world application, and I'll only briefly talk about it because our colleagues from Lao PDR are going to talk about this in length, but is the Green Primary Care Project in Lao, which is a larger project done in 5 provinces across 27 facilities, which was the first Type 2B project. And the CRVA here assessed mostly the current climate, but also the future climate, and identified key adaptation requirements within the primary healthcare system necessary to address potential vulnerabilities to ensure that the system is climate resilient for the future. Now, one of the key things here that made this CRVA such a big success was that we had a very strong collaboration together with the Ministry of Health. There was a balanced rigor with the policy timelines and the timelines that was necessary for the CRVA. And fundamentally, the CRVA that we've done here really catalyzed, I think, project development and was part of the foundation of how we designed the activities together with the ministry that was part of the Type 2B project. Now, the final slide are my key takeaways. The CRVA is foundational for Type 2B eligibility and also fundamental for climate finance access. The approach needs to be systematic, but I would argue still flexible. We use a framework looking at the hazards, exposure, and vulnerability and integrate that to prioritize adaptation activities. You can do a CRVA largely with tools that are widely accessible. You can use models directly like CMIP6, or you can access them through the World Bank portal in combination with tools like Think Hazard, the GIS, and WHO frameworks. And finally, in Type 2B projects, the main aim is for the CRVA to directly inform what the climate risks are and how to mitigate these risks with project-based activities. And with that, I'd like to thank you for your attention. I look forward to any questions. Thank you.
Thanks very much, Jasper, for that really detailed breakdown of the CRVA process and also some of the tools that can be applied across different settings. If anyone does have any questions or comments about the CRVA or how specific tools can be applied in the context of your country, please take the opportunity to ask our experts who are here in the chat. Our next speaker is Dr. Passumpun who is the Chief of ODA in the Department of Planning and Finance in the Ministry of Health in Laos, PDR. Dr. Passumpun has extensive experience both leading planning, investment, monitoring and evaluation, and also large-scale health sector development programs in collaboration with both national and international partners. He will now showcase how the key principles and features of Type 2B projects have been applied in the Lao Green Primary Care Project. So over to you, Dr. Passumpun. Thank you.
Yeah, thank you for everyone. Yes. Yes. Yeah, you can see my slide, but it's not full slide.
Yes, we just need to put into presenter mode. Yeah.
At the moment.
The slideshow start from beginning or.
Yeah, at the moment. At the moment.
That's okay. We're running right on time, so that's fine.
I can see.
Click the display setting, please.
Okay.
Yeah, that one.
Okay. Can you see my screen?
No, it's still not up there. Could you try again, please? Yes, perfect. Thank you. Go ahead.
Yes, can see?
Yes, perfect. Thank you.
Yeah, thank you, everyone. Yeah, thank you, everyone. May I share the Lao King Family Care project in Laos. May I need to brief an overview the project management. In Laos the executive agency the Ministry of Health the true Department of Planning and Finance. We established in the PMU project management unit in DPF as well. The PIU, the project implementation in the central level, we have the two. The first one is DPF. The second one is Department of Hygiene and Health Promotion. And another one is we have the NAPSAAT. NAPSAAT, it means is the environment, water, and sanitation central to implementation this one. And we have is the 5 provinces in implementation in the project, but for the infrastructure related with this climate change, with more is 10 provinces. In Laos is highly sensitive to climate change. In from 2022, this index in Laos is ranked 21st out of 121 countries. The temperature will rise by 2.5 and 5 degrees Celsius under medium and high emission scenario, increasing the risk and distress and vector-borne illness. Expectation period will be shorter but more intensive, especially during the monsoon season. Increase the risk landsliding and flooding. And outside the monsoon season, the risk of drought will increase, impacting sustainable agriculture, currently employing 70% of the population. In the gap, in the Laos, we have a gap related with this climate change and community resilience. Laos is a forthcoming health national adaptation plan, identify key vulnerability. Fragmented policy sector will do not enable information sharing and policy coordination and on cross-sectoral climate and health challenges. A limited capacity in service delivery due to poor infrastructure and low workforce capacity. Poor community resilience to climate change impact on health, including limited early warning system and adaptation. In the project, in the Clean Primary Care project support low carbon climate resilient primary care in rural vulnerable district of Laos PDR, and track key vulnerability at central output one service delivery, output one community, and the third one is level. These are the detail, the output of the project. It's an impact on the health related the sustainable development goal achieved by 2030. Its outcome gender responsive and climate resilient primary care strengthen. Output 1, primary care governance improve. And we have a sub-output. Sub-output number 1 is a strengthening of primary care policy and plan at the national level. If assess upgrade the policy and primary care. The second one is strengthening and healthcare management function. That one is focus on equipment, water, waste supply, and public finance management. The third one is strengthening of the province and district health office. primary care management policy capacity to delegate knowledge transfer and primary care management fund. Output 2, primary care service extension. This one we focus on is the facility build and refurbishing and equipment district hospital and health center. Train workforce on primary care topic, especially in MCH, NCD, etc., and systematics. 2, the health worker licensing and registration system. This one is under HPC Health Professional Council, who work with licensing and registration for the health. And support nurses and midwife to be at 85% of the health center by 2030 in alignment with its government priority. Train, equip, and facilitate transport to our risk team and digitalize family health funder. And our output number 3, primary care climate resilience improve. National coordination and climate and health, including updating of the policy such as health national adaptation plan and generation of data on climate induced diseases, especially is nutrition and livestock. Provincial communication campaign on climate and health, climate resilience and adaptation intervention in highly vulnerable districts, level 4 and 5, health national adaptation plan. Example, early warning system for facility, training and workforce on climate induced diseases, climate proofing of health facility and community water system, disaster risk management and ensuring health care delivery during disaster, including minimum service package for women and girls in crisis. Last one in the community health and climate education. In the project, we have Thai to be clarification in the design principle, national alignment in the implementation in the project, the fully in the fully arrive with Lao PDR climate change and NCD. Evidence based inform the CRVA using CMIP6 things has a WHO framework link risk to design. Transformational scope, system-wide intervention across governance, infrastructure, service, community resilience. Measurable outcome, indicator is service continue water functionality and infrastructure resilience. Finance eligible is 100%, 40 million financing is qualified as adaptation finance under JOY ADB methodology. Is the project success factor, like Dr. Jasper mentioned, is a strong climate logistics. This activity responds to specific climate risk, especially flooding, wash upgrade. System level approach strengthen governance planning, health service and community resilience. Multi-hazard response address extreme heat, flood, drought, and vector-borne diseases. Building resilient platform pathway at local level, related with climate change education, early warming measures, and community adaptation planning. Policy foundation enabled by extensive and currently national adaptation plan. This one is for the green primary care project in the Lao PDR. Thank you, everyone. Okay, over to Helen.
Oh, thank you very much, Dr. Pasampun. I thought that's a great way to finish out the presentations with a real-life example of how some of the principles and tools in climate change adaptation have actually already been applied in Lao PDR. So thank you very much. I'd like to hand over now to Alexo Esperato, who is the Senior Health Specialist at the ADB Southeast Asia and Pacific region, to provide really his reflections on both the presentations, but also the way forward in this really important space of climate change adaptation. So over to you, Alexo. Thank you.
Thank you, Professor Brown, and I hope I'm audible. I'm actually traveling. So I'm just going to provide a few closing remarks. As we close this webinar, we would like to thank, of course, our distinguished speakers for sharing their wisdom, as well as our audience for their engaging questions, which are coming up through the feed. ADB reaffirms, of course, its commitment to helping countries develop climate resilient projects. Today's webinar focused on Type 2B, climate projects at ADB. Type 2B is a pretty confusing name for saying that projects are climate certified or climate transformational. And these share several characteristics. The first one is an emphasis on climate adaptation at a systemic level, right? So not just strengthening climate adaptation facilities, not just climate proofing, but really taking both a policy perspective, facility strengthening perspective, strengthening the workforce perspective, and so on, right? Working with communities, et cetera, et cetera. And the Green Primary Care in the Lao PDR, it would be an example of that. Type 2 projects, which are, again, climate transformative projects, are also based on a rigorous analysis of the climate risks, and therefore base their interventions on those risks, right? In this sense, there can be a little bit of a tension sometimes, or a trade-off, because these are, after all, still health projects, right? So we're looking at strengthening the climate resilience of the health system while expanding the health system itself. Finally, Type 2B projects include a set of indicators to monitor that climate resilience as well as service expansion in many cases actually proceeds. As mentioned, the Lao PDR Green Primary Care project exemplifies all these interventions. One thing to note for our audience, for our distinguished participants from developing member countries, is that Type 2B projects or Type 2B certification is a requirement for projects to access grant funding from the Asian Development Fund, right? This can be pretty substantial grant funding. In principle, up to 1/3 of the loan amount, right? It's not easy to get to that level, but it's in theory possible. So we encourage you to take all these practices and lessons going forward, and would like to invite you to the next secure webinar. That would be webinar 27 that will focus on mental health, where we'll discuss the state of mental health in the intervention in the region as well as globally. So without further ado, thank you so much to everyone for participating, and Dr. Brown, over to you. Thank you.
Great. Thanks very much, Alexo, for those very succinct closing remarks. I'm pleased to say we're running right on time, so we do have time for questions. So thank you very much for the questions. The first question that we have is, and this is probably relevant for everyone, so whoever wants to answer, jump in. Can one of the panelists please share any insights and lessons in engaging with the private sector for financing type 2B projects. So maybe, Martin, are you okay to start with that?
Yes, so I will probably just give one insight and then let other panelists share their thoughts. When dealing with the private sector, well, let's be honest, their motivation is different. So I would try to start the conversation not by specifically mention climate resilience, but how the co-benefits can also help them achieve their uh, economic objectives, being which at the same time can help open or develop markets across our DMCs. The conversation, the approach of the conversation is it's different, but through different lenses, the ultimate goal is the same, which is building resilience of the whole country.
Great. Thank you. Did Jasper or Dr. Possenform want to add there? We do have the time.
Yeah, I'm happy to. Dr. Possenform, please go first, please.
For the Lao PDR, but not much for the private sector to concern about this one. We just only from the just related with is the project invest in private investor. We take care related with the environment should have the stake in the like soon and to protect is the nature environment, natural and forest, and also is the committee participate for is working in the like a worker in the just in private. That one is just only that one just not normal, just not is a mass form because in the like you know in Laos is still face in the economic or something. I think this compared with another country. Thank you.
So maybe I can add on to that a little bit. So maybe one thing to note, and you know, Martin can add to this because he's the expert, is that type 2B project and the type of financing that comes with that is quite specific to, I would argue, either climate funders or development banks. So I think the World Bank calls it a type 3 project. So it's the same concept but a different name. But it essentially means 100% adaptation finance. So I think it depends if you're talking about adaptation finance for these large scale projects that are health systems based, that are in the multi-millions. I think there's very few private sector donors or partners that would provide that level of funding to support that. That said, within Asia, there are a number of private sector, small private sector partners that can help and finance the foundational work. So one example is AVPN, which is a collection of philanthropic funders. They provide small scale funding, and that funding can be used to essentially catalyze more funding later on. So it can help to, for example, do that climate risk assessment or something else, or build the tools to do that, or set up the systems to collect that data, to then make that case to strengthen the health system. That would require a lot more funding, which I think arguably only bigger funders could provide, like ADB, like World Bank, the GCF, etc., that have that level and scale of funding. So that's one way I would see that there could be a potential for partnership, arguably, or financing from the private sector. And the other part, potentially, I could see is if the private sector comes in with really significant innovation. So I think they still come in with innovation. They don't necessarily come in as a funder, but maybe as a partner with an innovation in the health system that would help you strengthen that health system. And that could also increase the effectiveness of the project. But anyway, I'll stop there. But those are some of my thoughts, and I think how you could partner with it. Thank you.
Thank you. Just I think it's a good thing is like you mentioned that one is the in Laos is they have is not is the system for to control to manage is the fund from another donor or the sector who invest almost when they work closely directly with is the sector or the department concern, or maybe we don't know much about this one, or maybe if in the future we have the system, but in the now we have the many donors like ADB World Bank or who like financial institute they invest about this one, especially from the system like DSA2. Like now we include in the early warning system, including in the system in the can follow up is what is the issue, what is for the in the province, like for some example in the heat like a disaster or something we know in the information in the DSA2. Just anyway. Thank you.
Great. Thanks very much, everyone, for your responses. I think we've got time for one more question. So this it's kind of a two-part question, but in terms of the climate risk, vulnerability and adaptation assessment, we have one question or one part to the question that is saying, are climate risks actually attached to the project also taken into account? And secondly, to what extent does the process allow for local knowledge in the community, including Indigenous communities and traditional knowledge they might hold, to be included in the development of adaptation strategies?
I'm happy to take that one if it's helpful. So
yeah, thanks, Jess.
I can, so when it comes down to whether we consider the climate risk posed by the project itself, so going forward, one of the parts that, and I think I typed it also in the chat for those of you who are interested, but we do estimate the greenhouse gas emissions of any project and the addition of the greenhouse gas emissions. But I would argue that on a single project level, even the size of the project that's being implemented in Lao PDR, that additional greenhouse gas emissions is relatively small compared to the global or regional greenhouse gas emissions, which are underlying, I would argue, the climate change component. So yes, we do estimate that, and it's a requirement of the project and the climate change assessment that we've done for that project. Then when including local knowledge and knowledge from Indigenous communities, I can maybe give an example from our project where we worked with, I had the blessing of working with local consultants that were grounded in the community that indeed did that assessment. So that means that they went into the communities, they did focus group discussions and surveys and made sure that their voices were heard, but at the same time also to see how activities can strengthen those communities. And that's translated essentially in what Dr. Pasumpan also very nicely showed is output 3 of that project, which was really community focused. But I'll stop there and maybe anybody else wants to add on. Thank you.
Yeah, thank you. I can complement by saying that moving forward, all ADB projects since January 1st, 2026, all new projects will have to comply with a new environmental and safeguard framework, environmental and social framework, and the obligations of the governments and clients in the case of the private sector will have to comply with 10 standards. One of those standards is climate change, which outlines the climate risk management framework that I detailed in my last slide. And one of those other standards is stakeholder engagement. So stakeholder engagement should be as well throughout the project cycle at every stage. And specifically when deciding about how to reduce the vulnerabilities to climate change, what are going to be the adaptation solutions or resilience measures that are going to be implemented through the project, ideally should be discussed with all the relevant stakeholders, and of course considering valuing the local knowledge about how these existing climate risks have been dealt throughout generations and centuries, which we can learn a thing or two as well. That's everything that I wanted to mention. Thanks.
Great. Thank you. I'm just wondering, Dr. Posselpoon, whether you wanted to make a comment about the importance of the community stakeholder engagement in the project in Laos.
For the community, we have like a chief of the village or a chief Lao Women Union or Lao Fund. They can help us from the in the remote area we related with is especially in the northern part is onward is the mountainous, and also is a very hard and area is for the raining season they cannot access to the facility, health facility, because it's a landsliding and flooding or something like that. Is a in the community we promote is we persuade, we have the meeting with the committee, the village should participate in the protection in the chief of is from the plantation or something. They reduce in the cut the tree or for to protect the water in the mountain, because it's on what we still use in the water underground, water calamity in the rivers. That one is a community is very important to participate.
Fantastic. Thanks very much. I think that's just about perfect timing. It's almost 3 o'clock when we're scheduled to finish. So I'd just like to thank everyone. I think that's a very positive and encouraging note to end on. I think we are all very well aware of the scale of the challenge that climate change presents for health and other sectors as well. And sometimes that challenge can feel a little bit overwhelming. But I think the discussion today, which has demonstrated with a strong commitment, supported by also very clear frameworks and procedures, that transformation towards climate resilient health systems is well underway. So hopefully today's webinar has really provided everyone with some inspiration to seek out opportunities to design and implement Type 2B projects that can really play an important part in the journey to more climate resilient health systems. So once again, thank you very much to Dr. Banzon, to all the presenters, to the audience, and of course a special thanks to ADB Secure team for all their work in bringing the webinar to you here today. So thank you very much, and goodbye.